Well, first of all, I want to make clear that most individuals with schizophrenia will never engage in violence in their entire lifetime, and that was demonstrated by Strasnig and Associates. Perpetuating that belief would only be damaging to the community. However, it is crucial to acknowledge that the evidence does show that those with schizophrenia or other psychiatric disorders are at a higher risk of offending when compared with the general population. The literature provides us with some mixed results, with some researchers, such as Guo and colleagues, claiming the risk of violent offending for those with schizophrenia to be 2.44 times higher than the general population, while Lindquist and Albeck find the risk to be 4 to 7 times higher. However, it is important to note that Guo and colleagues' findings may be underestimating violent offending in individuals with schizophrenia due to how they base their data collection. Other studies, such as Koyman and others, also find that individuals with schizophrenia are 4 to 6 times more likely to display aggressive behavior when compared to the general population. Some more research needs to occur to find a conclusive reason for this, but Krakowski and Zober noticed that patients tend to engage more in aggressive behavior when their positive psychotic symptoms are elevated. Prusner and Associates explain that these heightened positive symptoms are due to an increase in dopamine production, which can lead to stress dysregulation. So, Hodgins and others hypothesize that aggressive behavior is how schizophrenic patients respond to these increased positive symptoms. Although studies do show us with some differing statistics and mixed results, we do know that the evidence shows that those with schizophrenia are at a higher risk of engaging in violence. As I have already established, those with schizophrenia are more likely to engage in violence than the general population. But it's interesting because Fassel and colleagues show the risk decreases when substance abuse is considered as a confounding factor. A multitude of studies have demonstrated that substance abuse is associated with an increased risk of aggressive behavior in individuals with schizophrenia. But the risk becomes minimal when only looking at schizophrenia without comorbid substance abuse. The issue, though, is that substance abuse is 5 times higher in individuals with schizophrenia, as explained by Cho and Associates. So it seems to be that there is some sort of shared genetic susceptibility with substance abuse and schizophrenia, and it may be that the risk of violence in schizophrenic individuals could be due to the substance abuse that's also occurring. Schizophrenia has multiple risk factors, but it's the comorbid substance dependence that is consistently associated with aggressive behavior. Overall, both schizophrenia and schizophrenia with comorbid substance abuse increases the risk of engaging in violence, but that risk is much smaller when substance abuse is not involved. So, with the way that the criminal justice system works is there must be proof that an accused person has committed a crime. However, the system also looks at the person's intent when committing the crime. For example, according to the judiciary of Scotland, murder is the intentional killing of a person, while culpable homicide is the unintentional killing of a person. While in both cases someone is deceased, these two charges come with different penalties because of the difference in intent. Some mental disorders can cause delusions, hallucinations, and overall impaired mental functioning, which can affect a person's understanding of reality. If an individual does not comprehend what's happening or cannot differentiate between right or wrong because of a mental disorder that isn't their fault, then it doesn't make sense and would even be inhumane to punish them as if they committed a crime with intent. Ideally, the point of prison is to protect the public from a potentially dangerous individual, as well as to rehabilitate them to not reoffend. But if a crime was committed due to a mental disorder, the individual will require treatment in a hospital setting to prevent any further crimes, especially because prisoners cannot be treated against their will in prison under the Mental Health Act. Sections 51A and 51B of the Criminal Procedure Scotland Act 1995, that was introduced by the Criminal Justice and Licensing Scotland Act 2010, provides more guidance on how to go about sentencing of mentally disordered offenders. But basically, A mentally disordered offender requires different treatment that cannot be obtained in prison than those who do not have a mental disorder, and they may be found to be less criminally responsible due to the nature of their disorder. It really varies from person to person, as every individual's case is unique. But luckily, researchers have been able to give us some guidance with their work. Hodgins demonstrates how children with conduct disorder or antisocial behavior who later present with schizophrenia in adulthood are responsible for most of the crimes committed by individuals with schizophrenia. And 20 to 40% present with conduct disorder prior to age 15. A major factor that can lead to conduct disorder in children and in turn future issues with violence in adults with schizophrenia is the kind of parenting that an individual experiences. Hodgins found that parents with schizophrenic children are more likely to present with antisocial behavior, which has been shown to contribute to non-optimal parenting by Jaffe and colleagues. And childhood trauma, such as abuse from parents, also contributes to potential violence. Furthermore, Sariaslin and others' research suggests that victimization and exposure to violence may lead to aggressive behavior, and they found that these triggers have the most effect on people with schizophrenia in comparison to the general population. Psychosis episodes and untreated psychosis are also huge risk factors for violence in schizophrenia. Multiple studies have found violence is most prominent during a first episode psychosis, which is why it is so important to have widely funded and available resources for mental disorders in both adults and children so that we can help with these risk factors and prevent the escalation to violence. Wallace and Associates explains that most individuals with schizophrenia who offend do so before first contact with mental health services, so the key here is early intervention. Antipsychotic treatment has shown to significantly reduce aggressive and violent behavior in individuals with schizophrenia, so much so that within days of treatment, aggression decreases. Plus, Fazel and colleagues' 2014 study demonstrated that individuals with schizophrenia are less likely to commit a violent crime when taking antipsychotics than when they are not receiving medication. So it really is important to diagnose and treat as early as possible. Also, as we previously discussed, substance use makes violence and aggressive behavior more likely in individuals with schizophrenia. So if comorbid substance abuse is present, then it is absolutely necessary to treat it to reduce the likelihood of engaging in violence. Funding of mental health resources is absolutely crucial in preventing violence and other offending in individuals with schizophrenia and other mental disorders. Without enough healthcare workers, psychiatric hospitals, and frequent psychiatric visits, we fail our communities and patients in keeping them healthy and safe.